Hello, Assalamu alaikum. History scenario. This is anaphylaxis. Scenario may that may that in the 6 years or 5 years old child at birthday party took a piece of cake and followed by there is severe reaction, and he was admitted to the emergency department and now take the history from her parents. And here, as we are, the settings is the side room of the emergency department, so we have to start talking in a soft tone. And hello, good morning, me Dr. Ruxana, one of child doctor here. Am I speaking to Mrs. Ahmed, mom of Ali? How are you? I know it's very difficult condition that she was admitted here yesterday with severe reaction. Yes. So I'm here to take a detailed history of his condition, and thereby I will take some note. Is it okay? Okay. So will you please tell me what was your main concern when it happened? Before this happened, do you notice anything? Can you describe the event for me? After event, what happened? And during this event, do you notice any change in his skin, any change in the breathing? Any change in the consciousness level? Okay, is it the first time? Okay. I understand this must be very difficult for you. And when you notice, what did you do? And then we will ask the constitutional symptoms. Is there any fever? Do you have any concern regarding her weight? And what was her daily activity? And then systemic query. Now I'm going to ask the symptoms of different parts of body to make sure that everything is okay. So does she has any kind of headache, weakness in the parts of body? Do you have any concern regarding her hearing and vision? And does she have any kind of cough, uh, sneezing, and any kind of telling you that any awareness of the heartbeat, racing heartbeat? Do you ever measure her blood pressure? Any tummy pain? What's about her poo? And can you tell me about her pee? And does she have any kind of skin lesion? Will you please describe it? Any joint pain? Does she is looking pale? Okay, and then we will ask the past illness. Does she have any kind of long extending illness other than this? Did she ever need any kind of hospitalization? And then is she under any kind of team, any kind of medication, any trauma, any surgery, traveling history, and then pregnancy history of mom. And then the important in the developmental history, JAPS history, and the important history now is the allergy history. Did she is allergic to any kind of food? So when you noticed it, what happened then? What do you do for it? Does he undergo any kind of test? Can you tell me about this? And what was the treatment is going on, and any hospitalization before? How many days? And do you have any EpiPen? Do you know how to use how many EpiPen do you have, and do you know how to use it? So other caregiver and school nurse aware of it, how to give it. And do you have any emergency action plan, any open access to hospital? And does she wear any bracelet? Does any dietitian is app involved? Will you please fully tell about her dietary? And here is a very important dietary history, which meal is going on in a specific type of food, who gave the food, and then and who prepared the food, and then other history, family history of atopic present or not, social history, school history, and at the home, is there any pet, smoking, carpet there or not? And then impact of this disease. And After this, there is presentation and then management. Management, I want, as there is airway, breathing, circulation, vital sign, heart rate, blood pressure, SpO2 monitoring, anthropometry, skin survey, respiratory system examination, cardiovascular system examination, and neurological examination in full skin survey. And then acute management, I will remove the allergen and give the adrenaline injection and IM injection, give the face mask oxygen. If after 5 minutes is not improved, so second dose of IM adrenaline, nebulous adrenaline if required, IV hydrocortisone. After 2 doses of adrenaline, if the condition is not improvement, so IV adrenaline, hydrocortisone. And if the shock, so management with the shock with the IV crystalloid fluid. And whenever there is recovery, at the same time we will send for our muscle tryptase level at the when the symptoms are the peak and when the symptoms is relief. And then after the child is stable, then we will discuss, give the education how to use the EpiPen, from where she can get this, and wearing the bracelet. And then follow up, we can give the oral steroid and oral antihistamine for 3 to 5 days. And then long-term management, pediatrician, dietitian, immunologist, school nurse, social group support, and then follow up. And other tests we can run on. So other tests maybe there is skin pricking test, IgA, radio allergosorbent testing, stool for if there is multi-food allergy, stool alpha-1 antitrypsin, eosinophilic cationic protein, IgA, cow's milk specific IgA. This is type 1 hypersensitivity, immediate hypersensitivity reaction. And others is the delayed hypersensitivity reaction, which one common is cow's milk protein and allergy. And test for cow's milk protein allergy, actually there is no specific test. We can elimination for 2 to 4 weeks and then reintroduce if the symptoms appear. So it is a diagnostic test. And then the management for cow's milk protein, remove the cow's milk and give the extensive hydrolysis formula. If not improved, amino acid based formula. Thank you very much. Assalamu alaikum.